Ladies and gentlemen, gossip day for town.
Fresh music from 042coded.com.
Is Lagos, Nigeria's commercial capital. It's a bustling city with a population of more than 15 million. And the outbreak of COVID-19 has people on edge.
I have to be very conscious because they say there's no cure for the disease yet. So I have to know the precautions, how to wash my hands, how to cover my nose.
I don't want to die. I have my own that I'm using inside shop. Because I'm collecting money from different people. So I need to use it.
But I must tell you the gospel truth. I'm scared of Africans. Most especially Nigeria, where I come from. Nigeria, and most especially my own village. I'm Lagos now. I can see what the governor in Lagos is doing, trying all his best to conquer this virus, which is coronavirus.
But the coronavirus is not the only health emergency in Africa's most populous country at the moment. Nigeria is currently dealing with an outbreak of Lassa fever, a virus that's spread by rodents. It only causes symptoms in 20% of those infected. But once a patient is symptomatic, the disease is severe and the death rate high. According to the World Health Organization, there have been 472 confirmed cases this year, and 70 of those have been fatal. So, is Nigeria capable of dealing with an outbreak of COVID-19, even as she battles with Lassa fever?
Behind me is the infectious disease hospital in Lagos, where coronavirus patients are being treated. To contain the outbreak, schools have been shut, large gatherings banned, and travel restrictions imposed on countries with high cases of COVID-19.
We're setting up isolation centers in all of our divisions, in all the 5 divisions. Even some of our retirees who we've started talking to, we've triggered them and they're waiting to be called upon if there's a need for that.
We don't have enough capacity. Even if we don't have Lassa fever right now, just to face corona alone, we are not ready.
Many are worried about the country's capacity to handle a major epidemic. Right now, there are just 5 testing centers in the whole country.
Konadu said coronavirus hasn't entered Nigeria yet. If it enter here, it will stop all over the world. Anytime it genuinely comes to Nigeria, that will be the end of coronavirus. How can you come here? Matada kapa sakateya. What does he mean? They told us that one Italian man brought it. The Italian man we didn't see. Nobody has been able to show us that Italian man.
Will you keep quiet? Now go kill Papa.
Dying in Kano metropolis is quite alarming, though there is no official record on the number of fatalities. But in Koji quarters alone, more than 70 people have died in 2 days. Most of the casualties are reported to be elderly.
They
brought a number of remains of people amounting to 70 in this cemetery. We buried 20 people this morning. In fact, the undertakers pleaded with us that work is too much for them, as more are coming.
The situation at the Tarauni Cemetery, another suburb in Kano metropolis, the story is the same, as 40 people were reportedly buried, while at that of Dandolo recorded 35. All these incidences occurred within 2 or 3 days. This ugly trend is raising concern among the medical experts on the causes of such tragedy.
Any patient that is suspected to have COVID-19 infection, the proper steps will be taken. So even there is increased number of deaths, it's unlikely that this number of deaths are due to COVID-19 because such people are treated separately, such people are given separate special attention, so that they will not be allowed to contaminate or to infect other people. So if indeed there is an increase in the number of deaths in the last 48 hours, it's something that needs to be verified, it's something that needs to be investigated.
Nigerian airport officials are on high alert trying to contain the spread of the new coronavirus as passengers arrive into Murtala Mohammed International Airport in Lagos. Airport health officials could be seen meticulously browsing through medical forms completed by passengers on Wednesday, with special interest on Chinese nationals aboard Ethiopian Airlines flight from Addis Ababa.
Government should work very hard in prevention because this disease has no any treatment, there is no vaccine, there is no medicament, there is no drug. So the prevention is the most important.
Nigerian who arrived in Lagos on board Ethiopian Airlines flight said she was scared at the prospect of having to sit in a middle seat and asked to change her seat.
Yeah, at first it breaks me. Like I'm basically like my seat today, I was being placed at the middle. I didn't want to sit there. I have to change because of being scared of the virus. But mostly it's God that protects. Avoiding, you don't know how it comes.
People have been urged to improve personal hygiene and avoid crowded places in light of the coronavirus. But there's little air travelers can do to avoid close human contact.